Hello and welcome, friends. Today I'm delighted to invite uh, my friend from my medical school, one of the coolest cardiologists that you will ever meet, Bakhtiar Ali. Bakhtiar, assalamu alaikum and welcome. How are you?
Walaikum Assalam, Farhan. First of all, Ramzan Mubarak.
Thank
Uh,
you.
and thank you for your kind words.
I
That's
have
very
to
kind
tell
of
you,
you.
I have to tell you that no word comes to my mind thinking about you other than being a cool guy. I don't know what's your secret of being a pleasant, cool person that everybody can walk up to you, talk to you, and want you to be their friend. Maybe you can shed some light on that today and tell us what is your secret.
I think actually, I don't know about the cool, but I think the pleasant or the dhima ona, I think I got it from my mom.
Is that right? Okay.
Exactly. I think when she also is like a soft person.
I know she has
So
a huge role in your families because I
absolutely.
think, she's been a strong supporter and pushing you guys to be who you are. And both of you, brothers Ijaz and Bakhtiar, I mean, we couldn't be more proud of you guys. You have excelled in your careers, in your lives, and we look forward to, seeing you and talking to you more about your journey of life today.
Absolutely. And
Um,
you're right about my mom's working hard. I mean, उनकी दुआएं थी, and I don't know if everybody in the class knew. My father passed away when I was 10 years old. So
yeah,
हमारे
I
तो
heard, I wasn't sure. So you were that young, huh?
yes.
It's
So of course, yeah, our mom raised us. She took a job as a lecturer and she teach at Islamabad College for Girls, and actually a lot of our class fellows were her students
Is that right?
at
Yeah,
IMC.
I
Yeah, yeah.
I remember people used to talk about it, and I wasn't exactly sure how long that your dad had passed away. I'm so sorry. I know it is hard to be without a father, but a mother figure like this is strong. I think we all owe a lot of respect and love for her devotion for raising the whole family. Um, so tell us a little bit about your high school and your choice of Rawalpindi Medical College as for your medical education.
Actually, that's a very good question. Okay, so high schools. So I was at Islamabad College for Boys. That was a big old institution in Islamabad. और मेरे साथ several of our class fellows, I've known them since we were seven. I was 7 years old. Farhan Sadiq, Adnan Safdar, Naveedullah Khan. We all went to the same school, and we all went FSC pre-med Kia, and then we all ended up at Rawalpindi Medical College.
Oh wow, nothing like
Yeah.
close old
Yeah.
friends, right?
Yes,
You
I've
can be
known them for,
yourself.
think about it, I've known those guys all my life.
Wow, and all are good people, I have to say. Uh,
Exactly.
you know,
And regarding Rawalpindi Medical College, so that actually is मेरी अम्मी का influence था.
okay,
So she was so her my nana, she was all into education. So there were four sisters, and he sent him but he was like a zamindar in Rahim Yar Khan,
okay,
and he wanted to educate his daughters. So he sent them all to like in Lahore College. So my mom, who actually was very good in her studies, she stayed in a hostel for FSC, and she thought that was the worst thing, and really affected her studies. And I think she blamed that for herself not becoming a doctor, even though her sisters became a doctor. So वो खिलाफ थी कि hostel में नहीं जाना था लोगों ने.
acha.
So so we got really good numbers FSC, but she was saying कि घर में रहोगे तुम रावलपिंडी मेडिकल कॉलेज जाओगे.
You know, Bakhtiar, you mentioned your grandfather, and I have to say that I want to pause here and say my tribute and my respects to him. In Pakistan, women are never given as much preference about education. They're thought, okay, their job is to get enough education that they can get married, and pretty much that's what happens. Many families don't tell their daughters to get educated. You have women in your families who are highly educated, really a moment of pride for all of us. And it's funny, my mom was like that too, what you said about hostel.
Mm.
So do you think it was a good decision going back, or do you ever tell your mom you should have let me gone to this college or this college, or do you like your time in RMC? Did you
I
enjoy
think
it?
it was given the circumstances, I think it was the right decision for me.
Yeah.
मेरे एफएससी में इतने नंबर नहीं आए थे कि मेरा किंग एडवर्ड में दाखिला होता. रिमेंबर दैट टाइम किंग एडवर्ड वाज द नंबर 1.
Yeah. Yeah.
तो मेरा
Yeah.
इलामा इकबाल में दाखिला हो जाना था, लेकिन इलामा इकबाल से तो बेहतर आई थिंक आरएमसी ही था मेरे ख्याल में.
And you had all your friends, you know, it's
Exactly.
almost like continuous,
Exactly.
and you excelled every year. You did better and better. I remember when we were almost at the end of our final year, both of you were mentally and mature enough and understand where you are heading, and you guys were already thinking about USMLE. Tell me a little bit about that last year. How did you make up your mind to come to United States?
Okay, so basically, the path to United States is actually a well-trodden path in my family.
Okay.
So again, goes back to my nana. So, two of his daughters are physicians. वो मेरे खाला अमेरिका में डॉक्टर हैं. तो मेरे एक मामू डॉक्टर हैं. वो भी अमेरिका में हैं. And they're all married to doctors. On top of that, my chacha, मेरे वालिद साहब के छोटे भाई, he used to be a surgeon in New Jersey. So मेरे फैमिली में ट्रेंड ही यही था कि आप एमबीबीएस करते हैं, देन आपने ट्रेनिंग के लिए अमेरिका जाना है. सो इट वाज नॉट कि मेरे, इट वाज समथिंग दैट आई हैड टू थिंक आउट ऑफ द बॉक्स कि अमेरिका जाऊं, इंग्लैंड जाऊं. इट वाज समथिंग दैट हैड बीन डिफाइंड इन माय क्लोज फैमिली way before I became a doctor.
Well, it's good, and but it puts a little bit of stress on you, right? You have no chance of failures there. You have to do good on your exams to be able to get accepted in a USMLE residency program. So I think it's good in a way that you have a path in front of you, but it doesn't make it easier.
I think it's a good enough way that it was defined. And going in, I mean, I don't know if you remember, I mean, like we both, myself and my brother, were very serious about our studies. क्योंकि हमें पता था कि हमने पढ़ाई करना है, हम इधर से सही तरह सीखेंगे, बेस अच्छा बनाएंगे, क्योंकि हमने यूएसएमएलई का एग्जाम देना है और वहाँ हमने सारी दुनिया के डॉक्टरों के साथ compete करना है for the limited spots.
Yeah.
So we were already, even our पहले दो शुरू से ही हमारा यही mindset था. So I think that having a goal did help.
Of course. And most of us, I think, can benefit from what you just said, because, you know, most people growing up in countries where we don't have enough exposure, or families not outside our country, we don't really know. We figure something will happen and that would be our life. But planning is important because it keeps us out of unnecessary stress and failures. So tell us a little bit about your preparation for USMLE and your acceptance into the residency program. Give us a little bit of like a few liners on that.
So क्योंकि मुझे पहले ही पता था कि मैंने अमेरिका जाना है, तो unlike majority जो हमारे classmates थे, तो मेरा था कि final prof के बाद I'm going to do USMLE. So I didn't do a house job.
Okay.
House job नहीं की थी.
Okay.
Which थोड़ा सा मुझे regret है कि I think now I see you guys everybody talking amongst yourself. और थोड़ा सा clinical आपका acumen बढ़ता है. Maybe I would have been a little bit stronger. अगर मैंने house job किया होता है, probably I would have been stronger. That might have been a bit of a mistake. लेकिन मेरा ये था कि मैंने final prof किया, फिर मैं USMLE के लिए बैठ गया. जब हम दे रहे थे उस वक्त पाकिस्तान में एग्जाम होना शुरू हो गया था. So I gave both part 1 and part 2.
Okay.
Then applied for residency. Then they had that CS exam जो करते हैं.
Okay.
वो किया.
So you ended up starting your residency at Wayne State. Tell us a little bit about that residency program.
So it is, I don't know how much you're familiar with Detroit. तो शहर का काफी बुरा हाल है. उस ज़माने में तो काफी बुरा हाल था उस शहर का. It was like
a rundown city.
It's
you
a
know,
rundown
it's
city.
yeah.
I mean, the hospital was like one of the peripheral hospitals of Wayne State, which was still in the city of Detroit. So it is like one of those hospitals. सारे गरीब गुरबा आते थे. It was almost like your patient pathology was like almost same as Pakistan.
Achha, that's interesting.
And the ER had a huge trauma center. I mean, all the
gunshots and stuff. And
exactly. So the interesting thing is for the emergency medicine residency program, all the top medical students want to go there because they saw so much trauma.
Oh, wow.
Yes, and
Okay.
it was a good trauma program. So so we saw a lot of pathology. It was a clinically extremely strong program, because our teachers wanted us to. By the time you're a second year resident, you're running your own team. With the attending would just step back and let you manage your patients. And the ICU was a very strong ICU team. So it was really fantastic clinical training for me, given the amount of pathology and the amount of independence we got to
Wow.
make
And
clinical
it's,
decision and managing patients. Then I've seen some other programs which are bigger, maybe suburban programs. You have a patient populations which is more affluent. To attending डरा होता है कि मैं गलती होगी, I'll get sued or something. तो वो residents को ज़्यादा independence नहीं देता.
that's a key in learning and getting the confidence. So I think what you could not do it in your house job, you actually maybe doubled up that experience from Wayne State, which is good. I have to say that one of my friends, I don't know exactly what his residency was. I want to say it was Wayne State. He did fellowship with me, and he was clinically really strong, and I think
Yes.
he used to tell me the same kind of aspect. So I'm glad that you got that opportunity. So let me tell you that when I heard about you becoming cardiologist, um, I was not surprised, but then later on I found out that you became an interventional cardiologist, and then I've looked up a little bit about you on Google, and I'm impressed by the training that you have actually put into it to become where you are. I don't want to say everything. I want you to explain to it, but it seems like you have dedicated about 1 to 2 years in research. Then you went to great training programs for cardiology, a famous one, which are actually really run by extremely competent interventional cardiologists. So I want you to tell me your journey to become a cardiologist and seek for high ranking places to get training.
Yeah, I think a lot of it was, I think, Allah ki marzi.
Okay.
Okay, in terms of where I ended up.
Yeah.
क्योंकि I did not expect to be getting, honestly मैं नहीं expect कर रहा था कि I would be training with people who have written our textbooks.
Textbooks. Yeah.
So
Yeah.
Rawalpindi Medical College से उठ के Punjab University से these are the people who are teaching you.
Yeah, it's impressive.
So that was because I look at back, and there were many points through in this journey कि easily I could not have been a cardiologist or interventionalist, कुछ और हो सकता था, but at the last moment something happened. I ended up where I ended up. So of course, I'll get, it was I give God credit for that. And I'm not. No,
Did
that
you
sounded
do 2
very
years of
arrogant.
research?
No,
Did you?
that sounded arrogant. Allah की मर्जी थी कि मैं कौन होता हूँ credit देने वाला. But you know what
Yeah,
I'm trying to
I
say.
know what you mean, and
Yeah,
it's
yeah,
you know it's it's obvious that God has been kind on you, but again, you have done your job. What did you do? 2 years of research or 1 year of research in cardiology at
So
Emory?
basically, yeah. So basically, when I did during my internal medicine training, Pakistan, I did not even know there was something called interventional cardiologist.
Okay.
I heard there was like a one-liner on our textbook about angioplasty. That's all I knew. Then one day during my residency, I read a description of an interventional cardiologist, and I actually found myself getting excited.
Okay.
And I asked the guy sitting next to me, who are these people? They go like, say, internal medicine, then then you this subsequent training.
Yeah.
And I remember myself getting excited. I remember my breathing getting faster and my heart beating faster. I knew at
Yeah.
that point
Wow.
that I'm going to be an interventional cardiologist.
Wow. Your inner self was telling you that
Telling
that's
me.
your calling.
Then I put in the work, and yes, and it's you've been through this system here, and it's one of the more competitive fields to get into, where a lot of people want to do it. Part of it's because I think people find it exciting. I mean, there's a financial aspect to it, and people are gravitate toward that speciality. So I knew, being somebody from Pakistan, I had to beef up my CV to get a stronger candidate, because I'm competing with everybody from the top residency programs in the United States. So I put in 2 years for basically full-time as a researcher after my internal medicine residency. And I came here at Atlanta VA Hospital, which is one of the Emory University hospitals, with an Iranian guy, Dr. Zafari.
Hmm.
I emailed him, and he basically thought I was an Iranian because Bakhtiar is a very common Iranian name. So he basically called me. Found out later I'm Pakistani, but but, but I think that's
That's
the reason I got the interview with him.
very nice. So that tells me two things. Number one, to achieve something higher than what you think you can easily walk into, you have to put in an effort, and even effort of not only physical devotion, time devotion. It's an investment. 2 years. You know, all of us, when they ever we talk about fellowships and training, a lot of my colleagues used to say, "Well, 2 years is worth 2 years of salary. I'm not gonna make up that money if I go and do research." You give up that money
Yes,
you could have made as a hospitalist, right?
yes,
Um,
yes.
and you work on it, and you did pretty well, because I'm looking at it. You got a junior investigator award as a stipend for American Heart Association. So, what was the research like?
So basically, we were doing research on cardiac arrest, cardiopulmonary
Oh,
resuscitation, and the people who do that research are called resuscitation scientists.
interesting.
So basic and because actually I got ended up a really good mentor who basically, because I was not trained how to write medical papers or how to
Yeah,
present yourself
none
medically.
of us are.
And
I
I
mean,
mean, I mean, we did not even know how to write a personal statement, if you remember.
I remember. Yeah,
Yeah, I
yeah.
mean, so he basically really improved my writing, my medical writing, and he pushed me to it. He would keep sending my drafts back, and he said, "Listen, I'm pushing you because you need to
Good,
be pushed."
good for you. Good for
And
you.
the result of that is then I got really good publications in good journals, and I was not expecting that, so it was really good.
Amazing. So where did you end up for your fellowship then?
So for my fellowship, again, आप कहते हैं कि लोग कहते हैं कि अल्लाह का कदर होता है.
Yep.
सो 2 साल मैंने रिसर्च इनके साथ किया था, तो मेरे साथ उस जमाने मेरे साथ 9/11 सारा हो गया था और मेरे वीजे के बड़े इश्यूज थे मेरे.
Yeah.
आई वाज इन वन ऑफ दोस गाइज फॉर लिम्बोस कि आपका ग्रीन कार्ड अप्रूव हो गया लेकिन स्टिल नॉट अप्रूव क्योंकि FBI हैज टू डू सिक्योरिटी
Background
चेक.
check. Yeah.
तो उसमें मेरे वीजा के बड़ा मेसी था. द प्रोग्राम्स डिड नॉट वांट टू टेक मी ऑन बिकॉज़ दे डोंट वांट टू डील विद दोस इश्यूज.
Hmm.
सो मैं थोड़ा सा गिव अप करने लगा. एट दैट सेम पॉइंट मुझे कॉर्नेल यूनिवर्सिटी से पल्मोनरी क्रिटिकल केयर का फेलोशिप ऑफर हो गई मुझे. And that's one of
Acha.
the things I actually like.
That's a great program too.
There's a great program. And plus, my wife was started her residency in New York at that time.
Okay.
So और उस वक्त मैं अटलांटा में था. So मैं कहा ठीक है maybe, but उसके ज्वाइन करने से पहले there was opening here at University of Texas at Houston.
Hmm.
They had one fellow who had dropped off. और मेरा एक दोस्त था कहता है कम आके इंटरव्यू करो. So my
Wonderful.
CV because of the research was pretty strong. So they invited me for the interview. And मेरे साथ जो इंटरव्यू कर रहे थे somebody जो प्रोग्राम डायरेक्टर के दोस्त का बेटा था. वो चाहता था कि वो जाए. But
Okay.
there's a
Favorism.
committee.
Yeah.
But
Yeah.
there's a committee though. One person
Yeah.
cannot do that in this
One.
country.
Yeah. Yeah. That's fair thing about American
Yeah. So
uh,
पांच जो बाकी
presidency.
कमेटी के 4 बंदों को मैं पसंद आ गया.
Wow.
So that's how I ended up at University of Texas at Houston.
You have to say the good thing about, you have to give credit where it is, and that's the beauty of American system, is at least that, favoritism happens, but if you are looking at a system like this, they selected the right guy. I want to ask you about the interventional training. How was it like? I always, I'm not the kind of guy who wants to be in emergency situation, just not my thing. Tell me about what is the intensity of these trainings?
So depends on the program.
Okay.
It is in general an intense field.
Huh.
I ended up again खुदा करना in the most intense program in the entire country. Again that was like क्योंकि normally आप तो पैथ जिधर आप जनरल कार्डियोलॉजी फेलोशिप करते हैं अब उसी प्रोग्राम में एवरीबॉडी नोज यू आप उसी में आप एक्स्ट्रा इंटरवेंशन ईयर कर देते हैं. मेरी वाइफ का हुआ था कि मैं आपको बताया कि न्यूयॉर्क में थी उस वक्त एंड देन शी हैड अ फेलोशिप नेफ्रोलॉजी फेलोशिप उसी शहर में मिल गया. सो आई डिडंट इवन अप्लाई टू माय ओन प्रोग्राम. आई ओनली अप्लाइड टू द प्रोग्राम्स इन न्यूयॉर्क.
Okay.
So because I applied there, I actually ended up at Mount Sinai Medical School, which
I know a famous guy there. I was there. Sharma something. He was like
Samin Sharma.
Samin
He's still
Sharma.
there.
So
So
that was the program you were in?
yes, yes. So that
Oh
is like
wow.
the, and so that's actually the Mount Sinai is a pretty top notch. Actually, it's a better program than when general fellowship की थी. So I ended up at a better program, or it was Farhan. It was the most. I mean, I've had brutal years. My first year of cardiology fellowship in 10 years, but that was the most brutal year of my life. सुबह आप 7 बजे आप जाते थे
Hmm.
as an interventional fellow. 8 बजे केसेस शुरू होते थे. On a normal day, you'll be done at midnight.
Are you kidding me?
अच्छा दिन होगा
That
रात के
much
8 बजे
load?
निकल जाएंगे और बुरे दिन में आपको 1-2 बज जाते हैं सुबह के because that place they are high volume and these guys and you as an international fellow were in charge of one lab. जो भी इस लैब में डायग्नोस्टिक आ रहा है कुछ हो रहा है you're in charge, you're running the cases, you're taking care of everything. And then you had Dr. Shamin Sharma, who was a very tough teacher, or his attending, because it was a high volume. They did a lot of complex stuff. They expect you to do work very hard, and they would they would like start. They would like a lot of times they won't scrub in. They would start like yelling. डांटे बहुत डांटते सारे
Oh
वो
really?
क्योंकि because
They're tough. Yeah.
वो इंडिया से हैं तो उनका थोड़ा सा इंडियन प्रोफेसर्स वाला एटीट्यूड था प्लस मेरा प्रोग्राम डायरेक्टर भी इंडिया से थी सो उनका ये था कि वो जिस तरह डांट के सिखाओ इनको
Yeah, डांट के सिखाओ. Yeah.
डांट
Tough
के सिखाओ
बनाओ. Tough
टफ
बनाओ.
बनाओ
Tough बनाओ.
and there's a wisdom behind it.
Yeah.
आपको बताऊं कि इंटरवेंशनल कार्डियोलॉजी में if you think about it, you're operating on the heart through a small hole.
Yeah.
It's heart surgery through a small hole. And if something wrong happens, कोई complication हो जाए, patient तो यूं करके जाता है नीचे.
So the sense of gravity of the situation has to be put in until they shout at you like, come on, wake up. This is like, you're going to kill somebody if you didn't.
Exactly. That's number
or
one.
You have to, their life is in your hand.
Exactly.
Save him.
And the second thing, if you have a complication, you need to have के हवास बाख्ता ना हो आपका.
Yeah.
You need to be able to handle it. Because I've been to other programs, where अगर किसी का complication होता है, वो लोग
They lose it, huh?
They lose it.
Yeah.
What he trained me to do was, if you have a complication, you don't lose it. And all that yelling, all that toughness was training for you so you can handle that pressure that one time your patient crashes. There's a complication. You're calm through it and you pull your patient back.
Yeah, this is great. I mean, I want to ask you a question. Mostly when you guys are doing CATs, there could be patients who have a very recent MI.
Mm-hmm.
And they can be hypotensive, they can be hemodynamically unstable, they can have arrhythmias on the table. And so you have to deal all of that. Are these CATs equipped for everything?
Yeah. So basically, I mean, we take cardiogenic patients and cardiogenic shock. We put like balloon pumps. I don't know how much you remember from residency. Put balloon pumps.
I know. I've heard about balloon pumps. Yeah.
Balloon pumps. Now there's something called impeller. So we absolutely pay patients. Even for a stable patient, if you're doing angioplasty in the heart and putting a stent in, they can go into ventricular arrhythmia. So we always put pads on during the case in case that happens. We shock them out. So absolutely, this because you're doing stuff to the heart. I mean, we do it so much that routine ka kaam ho gaya. But it is potentially, if you're not careful, I mean, somebody can die.
So how many cases do you think you do on average during your residency program, interventional CATs or any procedure?
So interventional training, our was a very high volume program. So I probably got back in like 3 years of training in 1 year.